Hello and welcome everyone to Cancer Support Scotland's second Wellbeing Session Q&A. We were absolutely delighted with how this first session went with Professor Jason Leach, and the recording for that session can be found on our YouTube channel. This week marks Mental Health Awareness Week, and given Cancer Support Scotland is here to support the well-being of those affected by cancer, we are over the moon to have joining us the Scottish Government's Interim Principal Medical Officer for Psychiatry, Dr. John Mitchell. Before we bring in Dr. Mitchell and our fabulous host, I want to briefly give you an overview of Cancer Support Scotland. In response to COVID-19, we've moved all our face-to-face counselling, complementary therapy services and podiatry services off air. We're now delivering face counselling and stress management workshops online and via telephone. And we've also developed a range of self-help and audio guides on our website. These are all free to use, so please do utilise these resources. Links will be displayed throughout this session. As well as this, the Scottish Cancer Coalition have produced an updated list of cancer charities in Scotland who are delivering services during COVID-19. And you can find this list via www.vhscotland.org.uk. And again, the link will be displayed at the bottom of the screen. So before we meet Dr. Mitchell, I want to introduce our fabulous host for today's event, our ambassador, Laura Boyd. Hi, Laura, how are you?
Hello, I'm good, thanks. How are you doing?
Yeah, not too bad, thank you. Not too bad. Are you looking forward to this next session?
I am indeed. The last one was just so informative and we got such great feedback from it. It was a real pleasure to do. So, and I think as you touched on there, it's Mental Health Awareness Week. And although everyone's getting better at talking about mental health, there's still a long way to go. So it's great for us to be able to put patients' questions directly to John, because I think cancer, depression, anxiety, sleepless nights often go hand in hand with it. And at this time, during the coronavirus epidemic, it's just heightened. So yeah, we've got quite a lot of questions to get through, and it's great that John's agreed to do this.
Absolutely. So without further ado, let's bring in John Mitchell, Dr. John Mitchell, and I'll leave you both to start the conversation.
Thanks, Rob.
Thanks very much.
Hi, John. Nice to see you via the wonders of the internet.
I know, nice to see you too, Laura. It's a great pleasure, isn't it, to be able to actually talk face to face with somebody rather than all the stuff we do on the telephone and emails at the moment.
Yeah, it's lovely to be able to see your face and to put these questions directly to you. So we've had quite a few in from cancer patients, and we've kind of put them into categories. And one of the big kind of main ones that came up was obviously shielding, because it's such a big issue for cancer patients. So I'll take it away with the first question. It was from Richard, and he said, what would your advice be for those struggling with long-term conditions or palliative conditions during shielding?
Well, I mean, the first thing I want to say is, just before I answer that question, I mean, it's fantastic to do this on Mental Health Awareness Week. I'm a consultant psychiatrist, and actually my special interest really all through my career has been cancer and palliative medicine. And I started my career as a wee baby doctor in the Marie Curie Hospice at Fairmile Head as a psychiatrist there. So, you know, I'm really grateful. I'm grateful to Cancer Support Scotland for doing this, but also the people who are asking the questions, because, you know, this is people's lives and it is really, really tough. Yeah. I mean, all of us have to look after ourselves at the moment, and the advice that I would give is advice that, you know, it is for the people, you know, asking questions here, but also for you, Laura, and also for me as well. Yeah. And that is that, you know, this is a really tough time for everybody. It's frightening and anxiety provoking, not knowing what the future is going to hold. And for people whose lives are affected by cancer, that's just so much worse. And we have to, I suppose, think about what we can control and what we can do. And of course, there are things that we all can do, whether we're affected by cancer or not, to improve our resilience and make us stronger, to fight back, really, and to promote our own, not just mental health, but physical health too.
Yeah.
So, you know that we are now allowed to go out and take exercise. And I mean, exercise doesn't necessarily mean lifting weights or going for a jog. Exercise is just about being active. It's just about moving around and actually spending less time sitting and lying and more time on our feet.
Yeah.
Getting outside, I mean, if you're fortunate enough to have a garden, or even if you can get and sit and look out the window, or and open the door and sit and look outside, I think connecting with nature is profoundly settling for people. And I would urge us to really focus on what's going on, the new leaves on the trees and the blue sky that we have the pleasure of looking at the moment, and reminding ourselves that there is a world out there that's okay, and one day it'll be okay for us too to get back out into that. We've got to think about keeping ourselves well also in terms of what we're eating, what we're drinking, and we've got to nourish ourselves emotionally by thinking about other people and ourselves. We've got to connect to other people. We're social animals, and we are nourished by our contact with other people. And that's why the theme of this week's mental health awareness is kindness. And really, I think we should think about how are we kind to ourselves, and how are we kind to others? And by being kind to others, we actually help ourselves.
Yeah.
So, the first thing I would say is really, we've got to think about that foundation of well-being in our own lives, and how we can optimize that for ourselves and other people. And we launched a website, clearyourhead.scot, that there's been adverts on television and things about. And that purposefully is a website not about mental illness and mental ill health. That's a website about well-being. It's a website for you, Laura, and for me, John, about our well-being and how we can optimize that. And it's got lots of good tips in it, and it's got connections to services that can support.
Fabulous. I think there is that thing. Obviously, some people are shielding, so they can't go out with their house, their flat, their garden. But if they do have a garden, or if any fresh air they can get, it does really, really help. I've got cancer myself, and I went on a well-being course, and I found it at first, the idea of being outside and connecting with nature, it sounds a bit kind of hippy-dippy, but actually it is amazing how much it helps. Just it just kind of clears your head, and it's so important. So hopefully, as things ease slightly, that will get better for people as well. So our next question is from Kim. She said, during the lockdown, we are expecting families to be bound by the self-isolating rules, which in many cases would allow their loved ones to die alone and not make memories with their terminal ill loved one. Do you think this is acceptable?
I mean, I think this is really tough, isn't it? I mean, losing people and being with people, while they're dying and knowing they're dying is bad at any time. And it, it's so individualistic for people. It's so, there is no rule book. There's no right way of doing it. There's no right way or wrong thing. It's profoundly challenging, and and on top of that, we've layered these rules now. We've layered these restrictions for people. And those restrictions are there, for the common good, for the public good. And it's about they're there about protecting the nation rather than actually thinking about people, an individual and an individual need. I mean, any NHS Inform, which is our kind of go-to website giving it information about this, I mean, it says that, shielding, for example, is actually a personal choice, and that people who are actually approaching the end of their life, or have very particular and special circumstances, are right to actually think, is this for me? Is this actually applicable to me? We all have to live with risk in our life, all of us, and that's, again, that's you and me, Laura, and we have to, at some degree, think, is this appropriate for us or not appropriate for us? Now, for me and you, we've a responsibility to other people out there, to stop this infection, and that's why I have to stick to the rules. But I think for people who are being shielded because they are really ill, or they're in the other categories, I think this has to be a personal choice, and a choice that they're not going to make lightly. So the opportunity to talk to friends and family and the staff, the health staff and social care staff that are involved with them about this is really fundamental. And I suppose, it is really difficult to talk about, but I suppose in preparing for loss and preparing for death, we can make promises to each other. We can make promises to connect, and reach out maybe later in a way that we can't do at the moment.
I've lost a friend during this time to cancer, and it was tragic. But I know further down the line we're planning to have a celebration of her life. So it's working ways around it, isn't it? It's such a difficult time. But as you say, speak to people about your own personal circumstances and come up with some kind of plan or arrangement that suits. Okay, Pauline, on the subject of shielding again, said, I'm worried about my family's mental health. They are shielding and can't go out and do the things they would normally do. They are shutting themselves away and won't talk to me or their CPN. I know lots of services aren't offering face-to-face services, but what if they won't phone to ask for help?
I worry about people who are shielding too. I particularly worry about the elderly who are shielding. And the isolation and loneliness that comes with that, and also that I think the anxiety of, well, when am I ever going to be able to come out of this? And actually, when I come out of this, am I going to be is the world going to be safe for me? So we've been thinking about that, and we've set up websites, and there's information, lots of information now for people. We've set up telephone lines. There's 111 through the NHS 24. But we've always had Breathing Space, which is a really great phone line that you can phone up if you're anxious or depressed, and have confidential counselling sessions with people. You've got, Cancer Support Scotland has got great support for people as well, and there are lots of organisations in this space. The difficulty is, that you've got to reach out for that, haven't you? You've got to pick up the phone, or you've got to know how your iPad works, to be able to kind of connect to this information, and that is tough. The people who are shielded, and the vulnerable people have been written to and have been given local phone lines, to connect them to the practical services that people need, the delivery of food, but more than that, the emotional support too. But when things get worse than that, and when people start to actually slip into mental illness, then we have to use the NHS that's there. GPs are still working and are still doing the job they've always done. They have to do it slightly differently. People who are COVID positive or potentially COVID positive are being seen, at separate special COVID hubs by GPs. But that means that ordinary GP surgeries are remaining a safe place for people to go to, for the usual reasons that we have to see a GP. So don't think that just because of COVID here you can't contact GP, somebody's GP, your own GP, you can't look for help. And certainly in community psychiatry, again, people are having to work from home more and more, but our community mental health teams have been asked to prioritise the work that they do and think really very carefully about what does a person who they've been told about, what are their particular problems, and how can they address those. And some people, like with chronic mental illness, instead of maybe seeing their community psychiatric nurse, every couple of weeks, they'll see that nurse, like you and I are doing at the moment, through digital means, or they'll speak to them on the phone. But there are situations where face-to-face contact has to happen. There are psychiatric emergencies, and there are situations where that has to happen. And using the kind of correct procedures, and if necessary, using PPE and all the rest of it, we have to do that. So the NHS is still open, and the mental health aspects of the NHS are still open. And if you're really worried about family members, you should deal with that no differently than you dealt with it, before COVID.
Yeah, I think that's really important to stress. We did that in the chat the other week as well, is that people do think things have shut down, and they maybe think, worries about mental health or stress are not as important at this moment because there is, coronavirus going on. But if you need help, you should still seek it out.
Absolutely.
That's the advice. Okay, germophobia, another big topic. Anne said, I'm struggling just now to leave the house. I haven't left the house since lockdown, and since my treatment has been put on pause, I don't need to leave. I know this will need to change, however, I'm struggling to deal with this. What advice could you give me for managing my anxiety around COVID-19 and wider germs? That's a big one. We're all going to come out of this, quite terrified about what we can touch and who we can see and things, aren't we?
I know. Well, we've all got germophobia now, haven't we? I mean, it's a good term, germophobia, because I think people know what it means, but it's really a sort of form of obsessive compulsive disorder, which is the term that psychiatrists would use. But I think my understanding, in the kind of cancer literature about germophobia is that it's actually slightly different than obsessive compulsive disorder, because it describes the spectrum of OCD, obsessive compulsive disorder, at the hard end, but the kind of natural and normal raised anxiety about the possibility of infection. So at the other end, so it's a sort of spectrum of anxiety that you're right, Laura. We're on it. We're on too. I'm on it, as well at the moment, because we're all worried about catching COVID and also transmitting COVID, infecting other people, and that's why we're washing our hands so often, to stop us, touching our faces and bringing the virus particles, but it also to stop us putting virus particles on surfaces. And this is a real fear, this is a real issue, and there's nothing that I can say that's going to just make it all go away. This is a big problem. I suppose the issue is, though, when when a person themselves recognizes that their fearfulness and their response to that fearfulness is actually so extreme that it is causing suffering in its own right. And in obsessive compulsive disorder, the real hallmark is when people recognize that their obsessive thinking or their compulsive behavior, their compulsions, are actually you know, they're
detrimental to their.
I was going to use the word bonkers, but I thought that's maybe not the right word to use for psychiatrists.
Detrimental maybe to their.
Well, people recognise that they're not they're beyond the normal kind of, you know, experience, and people themselves get really frustrated because they recognise that this is out of control, you know, and that, you know, that's really difficult. Now, in obsessive compulsive disorder, you know, there's evidence-based treatment for it, and there's really good psychological therapy based around cognitive behavioural therapy that works really well. Now, traditionally, we've done that face-to-face, but actually even before COVID, we discovered that cognitive behavioural therapy done on computer was actually really effective for some people, and people really like it. So even before COVID, we were building that up. So if you need to see a specialist for specialist therapy, you know, it's there, and people are skilled in doing it. There's also medicines that can help. You know, the obsessive compulsive behavior is really strongly associated with serotonin levels. On brain scanning, you can see a difference in the uptake of this on brain scanning in people. So, you know, I mean, I hesitate to say it because I think particularly if you've got cancer, you're probably going to be in a bucket of pills already, and the last thing you want is somebody else giving you pills. And I'm certainly not saying for, you know, germophobia, common anxiety, that, you know, that pills are the answer. But at the very, very hard end of this, you know, that is a possibility. But then I suppose at the, you know, the other end, you know, when we're thinking about really how we are behaving, about how often we're washing our hands, about how reasonably or unreasonably frightened we are to go outside the house, then we've got to try and, I suppose, try and take control of what we're able to take control of, you know, and you know, I was talking to somebody recently about, you know, anxious thoughts and anxious ruminations, and a problem that often a lot of people have is that just, you know, worrying and worrying and worrying and worrying. And a tip that some people have used very successfully is to say, well, these are real things that I need to worry about. And actually what I'm going to do is I'm going to set aside a certain amount of time each day that I'm just going to worry. I'm going to actually focus on what the worries are. And I might sit with a bit of paper and a pen to structure my worrying. And I might actually set an alarm clock so that, you know, I know when the alarm clock goes off, that's me spent my half hour or my hour or however long I want to spend worrying. And then once that stops, then I will stop myself worrying the rest of the day. I will distract myself. I will, you know, do other things. I will force myself to put the thoughts aside, knowing that tomorrow at 11 o'clock in the morning, I've got my worry hour, and that's when I'll do it. That's when I will you know, use that time for worrying. And some people do find that very helpful, actually.
It's often very helpful putting it down in black and white, isn't it? With a lot of these things, it is, you know, actually doing it. We've got this one kind of follows on, and you know, it's another. It's Peter. He is worried because his family think he's got OCD because he's constantly cleaning, but he doesn't want to risk getting the virus. He's worried about compromised immune system, doesn't want to take any risks. But how does he know what is right and what is wrong? Is his cleaning causing him harm? Do you think in part this is because we're so, all we've got really to focus on just now is being in the house and coronavirus, and as things ease, as we start to be able to get out more and things, should that kind of help with that? Or
I mean, you know, we've been told the things that we need to do to protect ourselves and other people. We've been told that you should be washed. You know, if you have contact with anybody outside the house, or if, you know, you go outside the house and you touch a handrail, or you pick up a loaf of bread in a supermarket, after you've done that, you should be washing your hands, properly, as they say. But you've got to, I suppose you'll know yourself, if you've been in the house all day on your own, and you've not picked up a letter that's come through the letterbox, and you've not, said hello to the postman when he's delivered something for you, and you've not been in, you've not gone down and bought a pint of milk, then actually, your hand washing should be proportionate, really. A good thorough washing of your hands, you should be doing that anyway as part of your ordinary personal hygiene. But repeatedly doing it during the day is not necessary. So that would give you a clue as to whether this is excessive or not. But also the clue, I think, also is in that sense of that this feels alien to somebody, that they recognise that how they're thinking and how they're behaving is just not right for the situation. So. And I think understanding, as I was saying about germophobia, it's quite a nice term for this whole spectrum of you and me worrying about the cleanliness of our hands and going outside, and the potential, that I'm going to catch this today or tomorrow. It's a possibility. To the far end of the spectrum where people are really, really suffering and limited because of obsessive compulsive disorder. And I think helping families to kind of understand that as well, helping our loved ones and our friends to understand it's not an either or. It's not like you just sort of got ordinary hand washing and stuff like the ordinary public, or you've got this really serious mental illness that's obsessive compulsive disorder. There's actually stuff in between, much of which is entirely understandable.
Yeah, completely. At this time, so many people are doing that kind of thing. It's so heightened at the moment. Carol was asking, how can I ever feel safe again if I'm living with both cancer and the fear of COVID-19?
I suppose we're never safe, are we? All of us live our lives distracted by television and work and family and friends and going out, and we choose not to reflect on the fact that we might be hit by a car today, or that we might catch influenza and die from influenza, as a lot of people do. Or that something terrible might happen. We have to live our life, and we have to sort of rise above that. And I think how ordinary folk do that is through a kind of denial, really, of the fact that we are surrounded by risk all the time, and you kind of have to, because you can't live your life in fear. I think time spent living your life in fears is just wasted time. You can't really. Nobody can escape for it. For some people, the risks are much, much higher. You've got cancer, then things might get worse, and you may die from this. And many of us are going to die from cancer. And we've got a pandemic of a new infection out there, out the window just now, and many of us are going to catch it. And there are a few people who are tragically going to die from that. That's the reality of life. But I don't know. You've got to think, what's the way I want to live my life? How long might I have, and what do I want for that time?
Be sensible, take the precautions, but don't waste your time here. I think when I was first diagnosed with cancer, and I was terrified of dying, and my mum said exactly as you said there. She said, Laura, you could walk out tomorrow and get hit by a bus. You can't think like this. And actually that's always stuck with me, and I found that really helpful. Right, next topic, education. So we heard a bit from Nicola Sturgeon about schools looking to go back in August. But Emma has said, I currently have cancer and I am shielding. I see from the news that there's talk about children going back to school. I'm so worried that my child missed out, or if he does go back to school, brings the virus home with him. How can I control this worry? It's slightly like what you touched on before, isn't it?
Yeah, it is. And I saw myself, at lunchtime today that the First Minister was giving us some idea about how the future might go. I mean, obviously schools have been open, all the time for a few people. I think my understanding is that they're aiming to have children sort of partly back in the class again in August.
Yeah.
And I think also, I mean, I'm not an expert on this, but I think I saw a paper that showed that actually the transmissibility from children is lower than from adults, which is really good news, because it, particularly for teachers who'll be quite anxious about going back into work. I mean, again, it's all about balance, isn't it? I suppose. Like young people's lives, we've got to get them back on track. Young people need to be back seeing their friends, getting back into school. I mean, I can't imagine what it must be like to be like an adolescent and have been kind of pulled out of school, potentially in the middle of exams, and now thinking, what's going to happen to me? When am I going to get back to this? I mean, I know. I can remember from my own school days. I remember, it's nice, like when you had to all go home when there was a fire alarm or something. But I'm sure, like for a lot of children, that's really worn off now.
Yeah.
Particularly because they'll be frustrated too, and stuck in the house, stuck in the garden. We've got to let young people back. By allowing that, we're investing in the future. Again, this is about kindness to young people. And also goes back to that idea of us living in risk all the time and having to weigh up all the time, that a member of my family is now going to start, there'll be people who'll start going back to work again, I mean, a lot of people already are doing that, but the same situation will be happening when people's partners are going back to the workplace and meeting people and coming back into the house after that. And again, there is no getting away from the fact that there is increased risk for that. Saying that, if we are getting on top of the virus and we're managing to reduce the reproduction rate and the amount of virus that's out there, then actually, hopefully, I think that the real risk will actually fall. But I don't have any simple answer to this, really. It's tough.
And hopefully by August, it's a few months away, we'll know more then, things might have settled down a bit more. So hopefully it's maybe something to try and not worry about and not think about too much just now. And then, as the time gets closer, then think about it.
And I think the idea of this test, trace, isolate and support program.
Yes.
The whole idea about that is that really the people that you, if you like, shield, the people that you isolate are the people who are infected or who are probably infected. And that lets everybody else out safer in the knowledge that actually, there's less virus out there. And that will be really good news, if that all, moves ahead.
Yeah, fingers crossed for that. Now, another big topic, work. Fiona said, do you agree that furlough leave is actually worse for people's mental well-being than being allowed back to work?
I mean, work is really good for us. Actually, going to work is really good for us. People need to be mentally healthy and well. People need purpose. They need something to focus on and a direction of travel in their life. And work is something that gives us that, gives a lot of people that. It also gives us social connectivity. And it also, it makes us be more active because, you know, just the sheer act of commuting and you know, walking to the office is beneficial. So, you know, these things have been kind of taken away by keeping people employed but at home. And indeed for people who are employed and at home, you know, this stuff's taken away from you as well. So we've got to kind of, I think the trick is that we've got to try and replace what's lost. And so having a direction of travel, having a purpose and having a goal is something that I think we can all think about. You know, okay, you can keep yourself busy with work, but if there isn't work to be doing, or if sadly you've been made unemployed or you're unemployed, then you've got to think about, well, what else can I do? You know, to give myself a sense of direction, and that might be volunteering. You know, and lots of people have stepped forward to do that, and volunteering has been shown to be really positively associated with mental health. This is pre-COVID. But also, you know, there's like lots of open university courses and all sorts of things. You know, you can learn languages, you can, but also, I suppose you can care and be kind for other people. You know, there's WhatsApp groups have been set up to make sure that old people who live on their own in your street aren't being left with nobody staying in contact with them. So you need to give yourself purpose. The second thing about social connectivity, well, you know, we need to do this, don't we? We need to connect in different ways, and you know, the activity I spoke about right at the beginning, you know, not taking the bus to work every day. You know, it doesn't stop you going out for a walk in the morning and a walk in the evening and pretending you're doing your daily commute.
And almost maintaining a sense of normality, because when you're down, it's very easy just to want to lie around in your pajamas and things, and those doobie days are fine. But I think, I know from personal experience, when I get up, I have a shower, I get dressed, you know, I make a kind of plan of what I'm going to do in the day, I feel so much better for it, you know. So I think it's trying to maintain some kind of sense of normality and routine, I feel like. Another question on the work subject, Paul said, whilst I have cancer, I've been managing to maintain some form of work as it helps with routine and to see mates at work. This has all been turned upside down. I've tried the stress management programs and looking at other support. However, long term, what can I do? It doesn't look like I will be back at work anytime soon. Well, I guess that's what you touched on there, finding other things to fill that time.
Yeah, I think that's fantastic that you know that people being at work. I mean, it's because it's good for you. And if work is taken away temporarily, then we have to think about, you know, how we can satisfy those needs for purpose, for social activity, and for activity, and look for other ways to do that. And you know, I don't know, you know, in terms of people's physical health and physical abilities, you know, that can be affected by cancer. That might limit your ability to volunteer to do things like, you know, deliver food to people who are shielded. You know, carrying big heavy boxes, you know, when you're just being treated for breast cancer might not be the easiest thing to do. But you know, there's other things that you can do as a volunteer, and there's other support you can give. And so, you know. You look for opportunities, you know, think about what you can do rather than what you can't do.
Now, well-being, obviously this is a well-being session, and we've got a lot of questions about this. So Kim said, how do you think we can support our loved ones who are fighting cancer during the COVID-19 lockdown, when the NHS has put so many restrictions on visiting, patients being allowed their own clothes, etc. in hospitals? Would it have been more sensible, do you think, to have a hospital for cancer patients only, which could have allowed open access for a family to visit?
Well, quite a lot there, isn't there?
Yes.
Yeah, I know. So, but all good points. So, starting off, Kim was asking about, you know, promoting well-being in yourself and other people, and I think I spoke about that earlier about, I suppose, physical activity and purpose, and you know, I think you, Laura, mentioned about regularity and about trying to have structure to your day, which is important too, and the kind of healthy living advice. And you know, if we're going to look after and worry about other people, we've got to look after and worry about ourselves first of all. So you know, when we are busy giving people advice about what to do to, you know, be as well as possible, you need to be, you know, doing it yourself as well, and practicing what you preach. So there are, latterly I worked a bit in Glasgow hospitals, and I used to go and get referrals for people in the Beatson Cancer Centre, and so you know, there is that you know, cancer specific environment for people. Cancer is so horribly common and so horribly different. You know, cancer can affect all different parts of your body in different ways, that actually it's everywhere in the National Health Service. You know, every GP practice, every hospital in Scotland will have to provide you know, help for people in different ways for cancer, and we can't really get around that. You know, we can't really you know, establish cancer only hospitals for people, because that just wouldn't be possible. I thought what was quite a good idea is this setting up of the COVID centres. You know, so for primary, as I said, because anybody who is likely to have COVID or because of COVID positive, you know, is seen by GPs and primary care staff in special separate places now, and that means that we can be more confident and less anxious about going to your standard GP practice. I think that was a good idea done. You know, it's the totality of primary care, but I think it would be very difficult to do that, you know, for cancer.
Okay, also on well-being, we had Peter who said, I was given a diagnosis in April for prostate cancer and was advised that they would be in touch in 12 weeks' time. However, no other support was given. Could you please provide some guidance as to where I can go to get support at this time?
Okay. Well, I mean, it depends what the nature of the support is. The well-being support, you know, it is there on clearyourhead.scot, and NHS Inform have got it. You know, the cancer charities, you know, like Cancer Support Scotland, have got fantastic websites and are telling it like it is. You know, they're telling it from the position of really understanding the challenges that people face. All of that is there. You know, the support for people feeling desperate for whatever reason is there through Breathing Space telephone line, and also Samaritans, you know, do a fantastic job, I think, for people who are in absolute crisis, about listening to them and helping them. That is all there. In terms of, I suppose, people's worry about their treatment for, you know, for prostate cancer and what's happening about that, then I think the clinical team that have been involved with that are the people you need to go and talk to. You know, they will know best, and I know that I think there's a couple of really good prostate cancer charities that have, you know, that I think again, their websites are freely available, and you know, I would be going to them and I would be seeking out their advice and support. So it really depends on what that level of, you know, of help is that's needed at the moment. Yeah.
I think that's a big thing for everyone, that, you know, anyone that feels that they do need support. So many of the charities are offering online sessions, you know, Cancer Support Scotland, online counselling sessions. So it is worth, go to Google, have a search, because there's certainly a lot of advice, and not just written advice or videos. You know, that there's ways of setting up counselling sessions and things. So there is a lot out there. So so try doing that. Another topic that came up quite a lot was sleep. So we had Dee who said, like many people, I've been struggling with sleep. This is common not just with cancer patients. So many of my friends have been saying this just now. I find myself worrying so much about my treatment, family, and the pressures coronavirus is going to have. What can I do?
Yeah, I mean, there's a lot of people having sleep problems in the population at the moment. Vivid dreams, sleep disturbance, worrying when they go to bed at night, and this is normal and common. And actually, if you just think about the unprecedented nature of what's happened to us all, it would it's not a surprise that our body reacts to that in a way. And sleep, I know from my psychiatric practice that sleep is a really important barometer measure of how people are. And I think often when we sometimes feel shy about asking people, how are you feeling? If we know somebody's, for example, got a depressive illness, rather than saying, how are you? How really are you? How are you feeling? That actually saying to people, how's your sleep? Is a really good way of finding out really how somebody is, and they're getting enough sleep and sleep of good enough quality. So again, I mean, there's great advice on sleep on NHS Inforum, and this is such a common problem that I'm used to giving advice about it. Physical exercise improves sleep. Being physically tired really improves your sleep. So if you're able to exercise during the day, then do that. Stimulants, surprise, just before you try and fall asleep, are the worst thing to do. And people
don't have a late night coffee.
Aye. People will know about, don't have a double espresso before you go to bed, but they might not think about other stimulants. So, your first alcoholic or second alcoholic drink is actually quite stimulating, and isn't really, the idea of a nightcap doesn't really help your sleep. But the other really modern bad stimulant that we're all guilty of is, guess what? It's screen time. It's taking your tablet or your phone to bed with you, and then you scrolling through, and that bright blue light shining into the back of your eyes, and also your brain, looking at the stuff. So maybe keep your Netflix, to the evening when you're sitting in the sofa. Don't take it to bed with you. The other thing is that we're really creatures of habit. We condition ourselves to do things in certain ways. And you probably know about Pavlov's dogs, that if you show a dog a sausage, it'll lick its lips and it'll start salivating. So what Pavlov did was, every time he showed a sausage, he rang a bell, and then he realized that actually, if you didn't have the sausage, if you just rang the bell, the dog salivated. And so what happens in humans is that when we go to our bedroom and get in our bed, the ritual of doing that, that's the ringing the bell for us to tell us to go to sleep. And so if you find that you're having real problems sleeping, you're in bed and you can't get to sleep, then don't try to, and don't stay in bed. Get up out of your bed and leave the room, because you need to teach yourself that bedroom and bed means falling asleep. Right. It doesn't mean Netflix, and sort of recreation. It means going to sleep. So getting into a kind of routine like that as well, having ordinary hours, getting to your bed at a regular time, exercising, don't stimulate your brain. And for people who are worrying, who are, the moment the lights are off and the stimulation level's down, and then the thoughts start going through their head, you can always try that trick of, no, I'll do that 11 o'clock tomorrow morning. I'll do that separately. The old Wives Remedies, chamomile tea, I don't like the taste of it, but some people swear by it.
Yeah, lavender on your pillow as well, people say.
Yeah, and I think again, smell is really powerful for us.
Yeah.
And I think that it might not only have what we would call a hypnotic effect, and that means it puts you to sleep. That's the right word, not hypnotizing you. It might not just have that, but also it's the Pavlov bell. So the smell of lavender, again, you might teach yourself that means sleep, and that's a really good thing to do. And the last thing to say is that sleeping tablets, are really not a good idea. And they're the benzodiazepine drugs like diazepam and temazepam, they will put anybody to sleep, but they are addictive drugs. You get tolerance, so you've got to push the dose up to get the same effect. And they don't give you the same quality of sleep. They don't give the same sleep architecture that normal sleep has.
Is that a kind of forced sleep then?
Yeah, it is, and it's not as healthy as sleep. So the only time that I really will use them is if somebody is really acutely distressed, like after a bereavement.
Yeah.
And they're acutely suffering, and you just need to allow somebody a few days of sleep. But I think but actually staying on a drug like this week after week after week after week is not a good thing to do. Yeah. So they've got their place, but I
try the other things first.
Yeah, absolutely.
Okay. We're just coming towards the end, but I've got a couple of general questions here. Hilary said, what is your opinion on how we improve the stigma of mental health in society? Obviously, that's what this week is about, trying to help. But what do you think, John?
Well, to everybody who's watching this, they're doing their bit, fighting the stigma about mental health. This is what I've worked in all my life, and I've seen the stigma. I've seen stigma towards people with mental health problems. I've seen stigma about mental health and stigma towards the people working in mental health. And it's actually all about fear, isn't it? It's fear of the other. It's fear of the unknown. It's fear that actually this might happen to me. If all of us have physical health, and none of us would expect to get through a whole life, or let alone even a year, without expecting some sort of physical health problem, some physical illness. And yet we don't judge ourselves because of that. Also, we shouldn't be doing the same about mental health. Everybody has mental health. Everybody has mental health. And we have bad times and we have good times, and we really shouldn't expect to go through a life without having a mental health disorder at some point. And that's what it is being human.
That's a great way to think about it. I hadn't thought of that before, but you're completely right. Yeah, it's just the same. It's your health in general. So yeah, that's a good way to put it. And finally, we'll finish up on a question here from Rob saying, there is rightly a lot of focus on well-being at present. What can be done to ensure that the same investment and focus is there to ensure the well-being of those affected by cancer is provided?
I've been really pleased because I suppose in my life I've seen the rise in awareness of the importance of mental health. And Scottish Government, has very clearly made this a priority, and the amount of funding that's actually gone into mental health, has actually significantly increased, and that is, that's really very, very welcome. I would like the public, putting, dipping in their pockets and putting more money in the charities for mental health, to the same level as they do for other conditions. But I mean, that's just, I suppose, bias on my part. I said right at the very start that I started off as a medical doctor who got disillusioned with general medicine and then went into psychiatry, and my passion has always been the connection between mental health and physical health, and that's why I've worked in acute physical hospitals as a psychiatrist for years. And there are lots of people like me. There's a thing called liaison psychiatry, which is the subspecialty of psychiatry to do with physical health. And so there are psychiatrists and psychiatric nurses and psychologists and psychiatric allied health professionals like physios and OTs
Mm-hmm.
who are working in physical health settings and are working with cancer patients and understand about the fact that 1 in 3 cancer patients are going to have depression and anxiety, and they understand about delirium, and they understand about the special problems. So, so I hope that liaison psychiatry flourishes. You know, I hope that people will see that there is a need that inside an acute hospital, you know, you need to have a whole range of different specialties, and one of those needs to be mental health. And my experience of working with cancer charities is just how lovely they have been over the years to me, and how psychologically aware they have always been. You know, and I think they do a really good job of thinking about the whole person. You know, that they recognise that people have this physical and mental health is all it's all the same. It's all part of the same thing.
As you say, there is a lot of help out there, and you know, it's worth asking your consultant, or you know, having a Google. There are plenty of things, and in Scotland, actually, we do have some great services like Cancer Support Scotland, Remedies, etc. So we are pretty lucky on that front. John, it's been a joy to chat to you, and so informative. I think Rob's going to join us now.
And thanks to the people who ask questions.
Yeah,
absolutely. Thank you very much, both Laura and John, for your time today. It's been great seeing some of the comments coming through on Facebook, Twitter and YouTube. And Dr. Mitchell, looks like you've got a fan. Donna McLeod has said that we need more of you.
That's lovely.
But I know Donna's also made some comments about remembering about reasonable adjustments as well to support people back to work, which is really, really important as well. I just want to thank you both for your time. Dr. Mitchell, I know you are incredibly busy just now dealing with the pandemic, and it is Mental Health Awareness Week, but thank you very much for your time. And
pleasure to be invited.
And thank you again to Laura. Absolutely fantastic questions, well put, and it's great hearing that first-hand experience as well. So thank you.
Thank you for having me.
Thank you.
Great. Further information on our next wellbeing session will be coming out shortly. So do keep an eye on our social media channels. And if you do need support, please do visit cancersupportscotland.org. There's information about the services that we provide for free, but there's also the Scottish Cancer Coalition's COVID-19 resources, and some resources that Dr. Mitchell and his team put together as well that's been shared across the screen. So there's plenty of support out there, and please do look after yourself, and hopefully you can enjoy some of the sunshine that's remaining. Thank you.
Thanks.
Thank you. Bye.